guys, it's Alice here. I'm a doula, a childbirth educator, and I'm here with the big wheel of birth to spin and see what topic we're going to cover today. Let's do it. Okay, today's topic is catheters. Catheter. So, funny enough, the very first topic on the wheel when we started spinning was poop. And it has been a very popular video because it is a question that a lot of people have in labor. So I'm kind of thinking this one, catheter, is kind of a follow-up to that one. And that topic, catheter, is the type of catheter that I'm talking about on the wheel is a urinary catheter. So while we had the video about poop, we are now doing a video about pee. Why not? We're going to cover all the exciting topics here on the big wheel of birth. So, catheters and whether you need them in labor. A couple of things. Let's talk about it. First of all, catheters are, if you're not familiar or you've never had a urinary catheter, it is a small tube that goes in through your urethra, and it is used to remove urine from your bladder. So there are two different types of urinary catheters that you might have experience when you're in labor. One is called a straight catheter, and that is when your nurse will insert the urinary catheter, will empty your bladder. It doesn't take very long. It's probably like start to finish, maybe 5 minutes. Empty your bladder, and then they remove the catheter, and then your bladder is empty. And if they need to do it again, then they would do that same procedure a second time, third time, whatever. The other type of catheter is called a Foley catheter. And with a Foley catheter, it is inserted into your urethra and it stays there until they decide to remove it. So as your bladder, as urine forms in your bladder, it goes out the catheter and into a bag. And if you're wondering, where is this bag of pee going to live? So what it is, it's a bag about this big, plastic. It's kind of a clear plastic, and it hangs on the side of your hospital bed. There's a little hook thing that they can hang it there. And so the pee will just be collecting in this bag from the catheter. Now, there are a few reasons why you would have a catheter in labor. The most common one is if you decide to do an epidural. So an epidural is when, what goes on with an epidural is that you are given medication into your spine, which makes your lower half of your body fairly numb. And so at that point, being able to stand up and walk to the bathroom is not usually possible when you have an epidural. And so after you have an epidural, your nurse will tell you whether you're going to have they're going to empty your bladder periodically with the straight catheter, or they're going to go ahead and put in a Foley catheter and just keep your bladder emptied. Now, the choice between the two really has to do with your facility where you're giving birth. Usually there is a policy or just a practice that they like one over the other. And as a doula, I've practiced in different areas of the country, and I've seen that it really just depends on the provider and the hospital policy on which one they choose to do. So if you have an epidural, that is one of the most common reasons why people get a urinary catheter in labor. The other reason would be if you are having a cesarean birth. Definitely with a cesarean birth, you would have a Foley catheter inserted. So you would have that inserted and it would stay for a while after the surgery until your care team feels that you are able to get up and move around and empty your bladder on your own. So that could take an extended amount of time. The other time, sometimes we see catheters inserted is if someone doesn't have an epidural, but for whatever reason they aren't able to empty their bladder. They aren't able to pee on their own. And occasionally it happens where the baby's head is really low, or the sensation is just really difficult to be able to pee. And I know as a doula, I have seen someone without an epidural have their bladder emptied with the straight catheter, and that way the bladder is emptied, and it's gives some room for the baby's head to come down in labor. The other thing I've seen is doing a straight catheter after someone has given birth if they have trouble peeing, if they have trouble emptying their bladder. That does happen sometimes. Sometimes it can just be hard to relax and release your bladder. And so if it is a concern that your bladder is really full, sometimes they will do a straight catheter after you give birth. So again, it's not a given that you'll definitely have a catheter in labor, but it is something that if you choose an epidural, it does come along with that. So it's the way that we empty our bladder if we can't do it on our own. So we have covered pee, and so it goes along with poop. If you liked this topic, hit that thumbs up and let me know. That also helps other people looking for the same information find this video. And if you're not subscribed to the channel, go ahead and subscribe, hit the notification bell, and you will see the rest of these topics when they come up. Okay guys, thanks for hanging out with me today. Talk to you soon. Bye.